Um, so welcome to the Breast Cancer Forum, and we are having a special summer edition because we can do this by Zoom and with our social distancing. So we decided to try having an event in August, which generally we have had a summer break. So we really appreciate everybody joining so far, and I think we're having an excellent session. I'm Hope Rugo from, of course, UCSF, and I'm joined this evening by Michelle Melisko in the Breast Care Center, and Natalie Marshall, who works at UCSF at our Berkeley campus, as well as having a clinic at our campus in San Francisco. Of course, we're really excited to talk about different areas that are important to breast cancer patients in the forum. And tonight we're going to be talking about exercise, diet, and other issues that affect patients with breast cancer, regardless of the stage of their disease. And I think you're going to hear from two people who are very, very interested in this area. Both Dr. Melisko and Dr. Marshall have been interested in this area, and Dr. Marshall is working on a specific program also for patients that she'll talk a little bit about. Of course, I want to thank Melody Gowlou for her excellent work in organizing the forum for us, as always. And we'll also to mention to you that the next forum is on September 30th with Diane Shumay and another colleague, and we'll talk about mindfulness in the time of COVID. I think that'll be a really great session as well. And also to mention that we record these forums now that we're doing by Zoom, and they're posted at the cancer.ucsf.edu/forum website. And we'll have that available to you at the end of the presentations tonight as well. So we're using Zoom, and you can answer questions. If you see the Q&A button on the bottom of your screen, you can actually type in questions on the Q&A section there, and we will address those questions as part of the questions and answer period. So find that Q&A button and do put in questions anytime, any thoughts that you have as we go along. So it's a pleasure to start our session tonight. We have Michelle Melisko, who's going to start out talking about exercise, and then we'll move on to Natalie Marshall, but we'll have plenty of time for questions and answers as we go along. So I'm just going to start those slides now. And introduce Michelle. You want to tell people a little bit about yourself and how you're interested in this area?
Sure. So I'm Michelle Melisko. I'm one of the breast medical oncologists, and I've been on the faculty at UCSF since 2003. And my interest in exercise actually started, what I would consider to be a little bit later in life, in that I grew up in upstate New York, which was extremely cold and not very conducive to outdoor activities other than snowmobiling and downhill skiing. And I didn't come from a family that did either of those things. And I had, I was a child of a single parent who really didn't have any time to exercise, nor really instilled in me any sort of ambition to exercise. And so when I moved off to college and met all of these people who couldn't, get through a day without going to the gym or going to out for the run or something like that, I, started dabbling in different forms of exercise and quickly realized that I was not into aerobics, and I was not very good on the exercise bike, but I really, really enjoyed running. And so I started running when I was about 20 years old. So that probably is why I can still run at almost the age of 50 without any knee difficulties, because I didn't start running when I was 12 or 11. And I remember in medical school, I met the first group of women that were running a marathon. And I actually thought that was kind of crazy, but I now moved to California, and then everybody was running marathons. And so in my second year of fellowship at UCSF, I ran my first marathon, and I've run about 15. I was actually planning to run my 16th marathon at the Paris Marathon this spring, but that was cut short by COVID. I also really enjoy swimming, and I have done some triathlons, but I still have a little bit of fear of the bike. And Natalie here is trying to tell me that, as I age, I need to get more involved with strength training. And I really agree with that, and also doing more stretching and balance work. So I'm coming to this with a perspective of someone who gets sort of my thrills and my sort of positive energy from aerobic exercise, but really, really emphasize the need to have balance. And so, exercise is such a big and important part of my life that it's often a struggle for me to understand when patients are saying, "I just can't get started. I don't enjoy it." But I think that when you hear how important breast cancer exercise can be, both to improving breast cancer outcomes as well as the data that exists for reducing side effects. I tell people that exercise is like a prescription. There's so many patients that are interested and willing to take different supplements. They want to know what they can do as far as lifestyle, and really exercise is the one thing out there that has some of the strongest and most compelling evidence that it actually improves outcomes. And so I'm going to start with that. I'm going to try not to get too deep or wordy into the slides that I'm presenting, and leave more of the time for Natalie to sort of talk about the real world experience and some of the great, some of the great ideas that she has to how to put this into exercise into the life of a busy cancer survivor or someone living and being treated for cancer. So, next slide. Oh, I do that? No, I can't do that because it's on yours. Okay, so you can go. So I just wanted to introduce, this picture here is one of my favorite exercise activities that I've ever done. And unfortunately, it's not going to happen this year. It is a fundraiser called Swim Across America. And I've actually swam it for 5 years in the past, except for this last year, with some of my breast cancer patients. And you have a boat and it drops you off about 100 yards inside the bay underneath the Golden Gate Bridge, and you swim in and swim like crazy. And it is one of the most amazing things I've ever done. Perhaps one of the hardest exercise endeavors I've ever done. And I highly, highly recommend it. And the money that's raised goes to pediatric oncology across the nation. So it doesn't go to breast cancer, but it does go to cancer treatment and supportive care for kids with cancer. Next slide. So I mentioned that, physical activity and exercise, has one of the most profound impacts of all of our lifestyle changes on outcomes in breast cancer. And so this slide, again, I don't want to dig into the data, but this is an example on the top left part of the slide. You can see these are names of studies, and on the left part of the slide, HR stands for hazard ratio, and that means hazard ratio of death from breast cancer. And so at a hazard ratio of less than 1, that would indicate that the more exercise that someone does, the greater outcome, or the better outcome, the lower risk of dying of breast cancer. And so on the left side of the screen, you can see that pretty much every study that has evaluated physical activity either before cancer diagnosis, and on the bottom of the screen after a cancer diagnosis, almost all of those dots fall to the left of 1, with some of the greatest effect sizes suggesting that exercise can reduce breast cancer death by as much as 50%. Those bars that go across the screen show the confidence interval, and the smaller the bar is tells us sort of how tight and how accurate the data is. But nonetheless, you can see here that that exercise, of physical activity, has a significant impact on reducing breast cancer death, and then all-cause death or all-cause mortality. Next slide. And so that previous slide kind of looked at all the different studies that have been published, and there's certainly more even since that analysis was done, on people being active both before breast cancer as well as after a breast cancer diagnosis. And you can't really change how you lived before your breast cancer diagnosis. In fact, it's kind of unfortunate that many of my patients come in and say, I did everything right, I was already exercising, I was already eating well, why did this happen? But you can change what you do after a breast cancer diagnosis. And this slide represents one of the studies that was on that previous slide, and it shows the impact on sort of a dose or prescription of exercise, and it looked at patients' activities. This was actually retrospectively reported, so patients were asked to report, how much they had exercised after their breast cancer diagnosis, and they broke it down into hours per week. And you can see here that women who did very little exercise, that was considered the control arm, and the control group of less than 3 hours per week. And then you could see that in women who exercised less or exercised more, there were actually fewer recurrences. And I should say this is actually not full hours per week. It represents MET hours per week. So I apologize for that, the typo on the slide. So it doesn't mean you have to exercise 15 to 23. That's 15 MET hours. And we can talk a little bit more about what that reflects. But what I think I want to show you here that's kind of interesting is that, the impact of exercise or physical activity on recurrence, it sort of peaks out at a certain point. And there's actually a point where maybe doing too much exercise may be harmful in terms of recurrence and breast cancer death. And that may have to do with, that if you exercise too vigorously, if you become too thin, that if you change your body composition too much, that may have a negative impact. And that's really, I was hoping to find a slide that was shown by an exercise physiologist from Memorial Sloan Kettering now. His name is Lee Jones, and he shows a picture of some mice. He does a lot of experiments with mice, and he throws them on exercise wheels, and he actually makes them do forced swimming. Not him, but his lab investigators. And they found that tumors grew more slowly in mice that were, sort of forced to swim a small amount. But if mice were forced to swim too much, their tumors actually grew faster. So, putting, mice anyway under a stress of too much exercise may not be good either. So this idea of, what is the proper dose of exercise for everyone is actually a very active area of investigation. Next slide. So, we talked, this is primarily about exercise, but, I think one of the most important, mediators of why, physical exercise is so important in breast cancer outcomes is the fact that many, many women do gain weight after a cancer diagnosis. Some of it is due to being more sedentary during their cancer treatment, and then the hormonal menopausal transition results in weight gain, and it makes it harder for women to lose weight. And so this is another one of those, what we call Fisher plots, that shows that what is the impact of having either moderate or high amount of weight gain after a cancer diagnosis. And this is actually based on all-cause mortality, so not specifically breast cancer mortality. And so again, looking at that line there where the hazard ratio is 1, you can see here that actually having a moderate amount of weight gain, so only 5 to 10% of the body weight, most of those dots actually kind of hang right around 1. So it doesn't seem to matter too much if you gain a little bit of weight after a diagnosis of breast cancer in terms of all-cause mortality. However, if you gain more than 10% of the baseline body weight, then that's when those dots sort of start to move to the right side of the screen, which means a hazard ratio of greater than 1 or an increased risk of all-cause mortality. And so the dot size reflects how big the study is. And you can see here that if you summarize all of these trials put together, that women who have greater than 10% weight gain after a diagnosis of breast cancer have a 23% higher rate of having, of basically dying, not of basically any cause. Next slide. So there have been so many studies that have looked at the impact of exercise in women with breast cancer, and they're actually, this slide here represents what's called a systematic review. And there's this thing called the Cochrane database that does reviews on all types of interesting medical questions and summarizes all the data very nicely for us. And so this Cochrane review was published in 2016, and it actually looked at 32 different randomized controlled trials in women who were getting different interventions during adjuvant therapy. 28 of these interventions included aerobic or exercise, or aerobic and resistance exercise. And the conclusions were that that receiving or undergoing physical therapy or participating in exercise physical activity during adjuvant treatment through some type of intervention improved overall physical fitness. It improved breast cancer specific quality of life. It improved cognitive function, muscle strength, and physical activity levels. And more so, there were studies that showed that it reduced fatigue, lymphedema, and mood disturbances. Next slide. And so here's an example, and of course, there's so many studies that they're so exhaustive that I can't cover all of them, but I picked out a few that I thought were some of the more recent studies that I thought were interesting. And some of them are small, and maybe they're just sort of demonstrate what what can be achieved by a very modest intervention. And so this was a small study, 62 cancer patients who had described having fairly severe joint pain related to their aromatase inhibitor. And they participated in a 6-week home-based self-directed walking program. So this did not involve a trainer, did not involve going to a gym. It was basically sort of a motivational program to get women to walk more. And the enrollment criteria, as I said, were women who had to have a pretty significant score on joint symptom intensity at their baseline. And they had to be fairly sedentary, exercising less than 150 minutes per week at baseline. And the outcome was actually self-reported joint symptoms and other quality of life psychosocial measures. Next slide. And what they found, so just to describe the patient population, they were 64 years old on average, 74% were white, and 63%, so almost a third of them, would have been considered overweight. And what they found is that after even just 6 weeks, the intervention group had significantly increased their minutes of walking per week. They described less stiffness, and they were able to do their activities of daily living better. They also described less perceived helplessness. So they felt like, I could really do something. I could have an effect on this problem that is troubling me so much. And then they looked at 6 months follow-up, and they actually found, unfortunately, that without that intervention, without that sort of cheering on of being part of the intervention, the walking minutes actually per week had decreased, but this improvements in stiffness and difficulty with the activities of daily living were maintained. Now, it's hard to know whether that was just because women were getting used to the aromatase inhibitor, but I would argue that if there were some, ongoing motivation, women would continue to walk, and maybe the improvements would be even greater. Next slide. Another study that I thought was interesting, and I mentioned that, I'm primarily a runner, but I started swimming just, for recreation and for exercise, about 15 years ago. So maybe 5 to 10 years after I started running. And I just found how therapeutic swimming is in terms of reducing body aches and pains. And so this study looked at an aquatic exercise program, not necessarily swimming, but something like water aerobics, in just a small number, 40 women. And they were randomized to either do this aquatic exercise program in a pool or be on what's called a waitlist control or usual care. And then the control patients had the opportunity to participate in the intervention later. And it was a 2-month intervention. There were 24 sessions, 3 days a week. And the bottom of the slide describes what they did in the pool. They did a 5-minute warm-up. They did 15 to 20 minutes of aerobic exercise, 15 minutes of mobility exercise, and then 20 minutes of recovery. Next slide. And what they found is that, there were no significant adverse events from this intervention, no worsening of pain. A really high percentage of patients adhered to the program and went to most of the sessions. And what they found was that participants actually had a decrease in their pain threshold in their neck, hands, and shoulders and legs. They had decreased waist circumference and also a borderline statistically significant cancer-related fatigue. And so those are all pretty impressive things to show in such a small study of only 40 patients with, 20 patients in each arm. As often happens with swimming, though, weight loss does not come easy with swimming. The body mass index did not show any significant improvement. Next slide. So just to summarize on, the impact of exercise, I mentioned that previous studies had shown a decrease in cancer-related fatigue. There is this American College of Sports Medicine roundtable that was put together, and some of the people, on this list, led by Catherine Schmitz, she's actually a PhD and a physical therapist that has made one of the most impactful studies, or published one of the most impactful studies, changing the way that we think about strength training and risk of lymphedema, and we'll talk about that a little bit later. Also, Melinda Irwin, who's been very involved with a number of exercise and lifestyle studies, were on this panel. And they looked at 16 different trials examining the effect of exercise on cancer-related fatigue, 7 that were interventions during their cancer treatment and 9 post-treatment, and almost all of the studies showed a favorable effect of exercise on fatigue. Next slide. This is an example of, one of these types of intervention studies. This is called the energy trial. So this one was actually looking at both the impact of exercise as well as changes in nutrition to try to enhance recovery and encourage weight loss in overweight or obese breast cancer survivors. This was a 2-year weight loss trial, and it included almost 700 breast cancer patients. The goal was to actually increase an average patients to get to an average of 60 minutes of exercise per day, which is actually a pretty tall order, and also to reduce calorie intake to a deficit of about 500 to 1,000 calories per day. So I must say that that's actually a pretty that's a pretty big bar to get to as well. The specific aims were looking at weight loss, quality of life, and then some biomarker studies to see what actually happens when we, introduce more exercise into this population where we, have a calorie deficit. And what you can see here on the right side of the screen is, kind of what kind of impact did they actually have, on these outcomes, and what, how compliant and how much change did we actually see in the intervention group. And so what they saw was that, over time, as expected, the amount of physical function that patients actually engaged in, dropped off, over the course of time. But they actually, and there was actually an improvement in vitality, but that actually also dropped off. So it was really tough. Oop, went back. There's a little bit, so it's really tough to get women to adhere to such a very, very aggressive and intensive regimen. But they did see weight loss in 6% of the intervention group and only 1.5% in the control group. And so basically, the tough thing is that it's just really hard to get people to stick with such an intimidating regimen, I would say. Next slide. And another small study that looked at, now this one is with 100 breast cancer survivors, tested out a 16-week aerobic and resistance exercise intervention. So trying to get women to do moderate to vigorous activity 3 times a week. And this one was looking at patients' overall physical fitness, their bone mineral density, bone biomarkers, and quality of life. And the exercise group actually had a very statistically significant improvement or maintenance of quality of life as compared to usual care. There was also a decrease in fatigue, depression, and then this estimated VO2. So that's basically their basically exercise fitness also improved, as well as their muscle strength. And what was great was that even at 3 months of follow-up, so at 3 months follow-up post-intervention, all of these patient-reported outcomes and the physical fitness variables remained improved compared to baseline in the exercise group. Next slide. And so I mentioned to you that Dr. Schmidt, the physical therapist, who was, basically was the first to show, and this was a big, big deal back in 2009 when it was published in the New England Journal of Medicine, that we used to think that women were told after having axillary surgery that they shouldn't lift more than 15 pounds. They should be very careful about lifting. And she was actually one of the first to show that doing some moderate intensity weightlifting actually improves, that actually reduces lymphedema. And so I'm not going to go into the details of this, but basically this single study showed us that we could actually, women could actually engage in some weight training after having axillary node surgery, and that it's actually beneficial to them. Next slide. Yep, that's great. Thanks, Hope. And going back to the idea about, the very first study that I showed about the exercise-induced, or the aromatase inhibitor-induced arthralgias and the impact of an exercise regimen. This was a study that was conducted by Melinda Irwin, again, one of those people that was on that exercise panel. And they enrolled patients that had been on an aromatase inhibitor for 6 months, had a higher score on this worst joint pain score on this brief pain inventory, and women who reported being fairly sedentary. In fact, women who reported participating in less than 90 minutes per week of aerobic exercise and basically no strength training. They were randomized to actually receive 150 minutes of exercise, including aerobic exercise as well as strength training 2 times a week, or they were basically received usual care. And at 12 months, the 61% of the patients that were assigned to exercise actually did participate in 70% of their resistance training sessions. So that's pretty high compliance. And they also increased their exercise on average by 159 minutes per week. So that was actually a very successful intervention. Next slide. And what they found here is that you can see here that the control group basically all had an increase in their pain scores, including both worst pain, pain severity, and pain interference, where there was a statistically significant reduction. Those exercisers are in the gray, where there was a decrease in all these components of pain at 12 months. Next slide. And then there was also, looking at the patients that participated in this study, they looked at endocrine-related quality of life, so factors like hot flashes, sleep disturbance, side effects that we associate with aromatase inhibitors. And you can see here that in the exercise group, they had a greater improvement in the overall quality of life measures, in the breast cancer specific quality of life, endocrine specific, and fatigue specific sections of these measurements. These thing called the FACT questionnaire and the SF36 measures a bunch of different symptoms, and they saw improvement in all these different subscales. And they saw that the effect size, there was actually a greater effect at 12 months than 6 months. So women continued to get better and tolerate their treatment better with this intervention. Next slide. So just to finish up here, you know, I love this picture. Sweat is fat crying, and you know, so I was asked. These slides were taken in part from a talk that I had given last year at the COBRACA Controversies in Breast Cancer conference that was held in San Francisco, and I was asked to speak on management of hormonal therapy side effects, and should we be treating patients, is it sweat or pharma? You know, so is it meds or sweat? And I was arguing for sweat, and I thought the winner was sweat. And so I will finish up there, and I'm gonna, you know, now transition, or hope can maybe, you know, make some comments, or I don't know if we want to take any questions that are up now, but we would transition over to Natalie, who I think is going to be giving us really practical ways of how we can get us to exercise, because these trials are very, very difficult to conduct. And as you can see, you know, sometimes they may be a bit too ambitious for particularly for, you know, our, you know, young, you know, population, especially now us all doing shelter in place, trying to manage our kids, our families, our jobs. So we need to know how to fit it all in, Natalie.
I'm just unmuting myself. So we have a couple of questions that came in before we start on with Natalie. So both of you maybe want to comment on it. One person has asked whether or not the benefit of exercise varies with the type of breast cancer. So we know that there are many types of breast cancers: hormone receptor positive, hormone receptor negative, HER2 positive, and that can have both the hormone status with it. So I'm going to ask you a couple of questions for both of you to expand on that. Does the benefit of exercise vary with the type of breast cancer? And does the impact of weight gain change based on the type of breast cancer you have?
Well, I'll go ahead and start. So, you know, these exercise studies, I mean, even the largest exercise trials, you know, are still relatively small compared to, you know, the very large randomized trials that have been done, you know, for adjuvant treatment of breast cancer, or the nutrition interventions. Like I was going to put in some slides from the women's interventional nutrition study in the WELL trial, which were, you know, 2,000, 3,000 patients. So to answer that question, you know, we don't know. We don't know the answer whether, you know, for example, you know, triple negative would get more benefit from exercise than an ER positive invasive lobular. But, you know, extrapolating from the, you know, the WINS trial, I think, you know, the WINS trial was a study that looked at a dietary intervention, a low-fat diet intervention for women with breast cancer. And I think everyone expected in that intervention, and patients always think about this, they're like, I shouldn't eat fat because fat makes, you know, estrogen, and that's bad for ER positive breast cancer. But in the WINS trial, the group that benefited the most from a low-fat diet was actually the triple negative patients. And they were actually the only group where there was actually a survival benefit demonstrated both groups, the ER positive and the triple negative patients, had fewer, there was improvements in disease-free survival with the low-fat diet, but it was only the triple negative patients that actually enjoyed an improvement in overall survival. So I think it's a complicated question because there are certainly differences about this biology, and exercise, as Natalie's going to talk about a little bit, has pretty profound impact on our sort of stress hormones, our insulin levels, and certainly that may have a bigger impact on certain diseases than certain types of breast cancer than others. But the bottom line is that any of the randomized clinical trials that have been done thus far have not been subdivided by disease or by breast cancer type. So that was my long answer to a short question.
Natalie, do you want to offer in some comments?
So the only thing that I would add, because all of these trials included people that were triple negative or estrogen positive, et cetera, is that there is data in postmenopausal women with ER positive breast cancer that weight gain can be detrimental, and losing even a small amount of weight, like 5% of the body weight, improves outcomes. So I think that there might be something about that with the postmenopausal estrogen positive breast cancers, but exercise benefits everyone.
Yeah, and I think that there's emerging data that suggests that even weight gain in younger women can result in a worse outcome. But again, it's primarily limited to patients with hormone receptor positive disease. But I think that this may be affected by competing risk, so your cancer stays around long enough to come back later. So there's a more of an impact of weight gain. But in some of the more aggressive subtypes of breast cancer, the duration of time to recurrence is short. And so we may not be able to see that impact, whereas the biology of the cancer cells themselves have such a big impact. So there's also one of the questions is, I think the answer is that we don't know that the benefit varies, and we think exercise is a really good thing regardless of the breast cancer you have, but that obviously you would need to tailor the exercise if you have advanced disease and have other symptoms that impact this. And I think Natalie will be talking more about that. Also then, the other question that somebody asked was how many minutes you'd suggest to exercise per day, and should somebody exercise every day or take 1 or 2 days break?
I can start with that one. So I think that what we know is that a lot of the studies were done with like a minimum of 150 minutes per week of moderate exercise. So I would say you can do it per week, or you could divide it into several days per week, or you could do a little bit less every day. And I don't think it matters which way you do it, whatever works with your lifestyle and whatever gets you out to actually do the activity. Unless you're doing very intensive exercise where your body feels kind of wrecked the next day, you don't have to take rest days. If you're doing intensive strength training, you probably do need to take some rest days. If you're running, like training for a marathon, maybe you can comment on that, Michelle. You might need to take rest days for that type of exercise, but for most patients, they don't have to take breaks.
Yeah, I think that, for sure. I mean, as a runner, I think you have to take breaks. I mean, I've during COVID, I've logged more miles than I have even when I was training for a marathon, because I was always, when I was doing, a 20-mile long run on a Saturday or Sunday, I never ran the next day. And now with COVID, I'm not training for a marathon anymore, but I'm going out for 5 to 10 miles, most days, and it's really painful. And so I stopped doing that, and I'm trying to get into more yoga and stretching and swimming as the pools open back up. So, but I think mixing it up is the important thing, and trying to mix up your activities is really important. And, one of those days that you would call a break, I think strength and balance training, which Natalie is going to talk about, and is just critically important as we get older. So I don't think you have to take a break, but definitely don't do the same thing every day.
Another question that came up was how much. You had mentioned that if you exercise really a whole lot, that might be bad. I don't know if you meant that about weight versus exercise, but the question was approximately how much exercise do you think would lead to worse results? I'm a cyclist with metastatic breast cancer, and I was wondering how many miles or elevation gain per week do you think would be too much? Does it depend on the speed? I'm riding about 80 miles a week. And should I write even more? Because I like that if I wasn't socially distancing, I would write it even more. And a connected question is if there's any exercise that is not good for breast cancer.
Well, I just showed that slide, the slide about the sort of dose of exercise that had this sort of met hours per week. And I think that the point of that is that, there is a point where it sort of peaks out, where, that you can't just keep doing more and more and more exercise, and that's better. And then I comment on, Lee Jones, mouse experiments, because I just thought, the pictures, the cartoons were, funny. I guess for animal lovers and mouse lovers, it wouldn't be so funny to see these mice all stressed out, because he had a cartoon with all these stress hormones coming out of the mice as they were, swimming. But I think that, certainly 80 miles per week of cycling, I'm not a cyclist, but that doesn't seem excessive. And I think that it really comes down to what is your, perceived intensity. If you feel like you're doing your body damage, if you feel really exhausted and nauseated and dehydrated at the end of a ride, that may not be good for you. Or, I think, if you're having to take NSAIDs, daily for the pain of your exercise, that probably isn't good for you. So I certainly don't think 80 miles per week is too much. And I think that the ideas we're going to learn about is the impact of really, really high intensity sustained exercise that might cause excessive release of stress hormones or cause problems with the joints and things like that, is kind of what that data is probably getting at. And I don't think that there's any exercise that's not good for breast cancer.
Yeah, I would agree with that. All exercise is good for breast cancer.
And you don't hope that there's too much, right? There's not too much of exercise. If you feel good and you're managing, it's okay.
I think so. Yep.
And do you think that if you're getting, and then I'm going to hand over the podium to Natalie, but if you're doing chemotherapy, you showed the data that doing, some kind of exercise during chemo, patients might actually do better. Are there days to avoid exercise, like the day or two after? And can you still build muscle and get stronger during chemotherapy?
So this is actually really interesting, because there have been studies of doing exercise, including strength training during chemotherapy for breast cancer patients and other types of cancer. And actually patients do better. They can build muscle. They have a lower hospitalization rate. They have a lower out-of-pocket cost because of not having to pay copays of being in the hospital. And they have less fatigue and less side effects from their treatment. So I think it's actually important to encourage patients to exercise during treatment and not to forbid it or tell them it's not the right time to exercise or even start exercising. What do you think, Hope?
Yeah, I mean, I agree. I think that a lot of times I'll tell people, depending on the kind of chemo that they're getting, that the first couple of days afterwards, they might not want to do extreme exercise. But for example, some of our patients will get joint pains or muscle pains from either the chemo or the growth factor shots. And I think that walking some can actually reduce some of those side effects. So we definitely don't want people to be in bed. But they also, I always tell people, it's like, you don't want to be, okay, I never did any exercise and now I'm going to run a marathon. That's not the time to do it. So, you want to be able to sort of do the exercise that you can manage. And I don't think that there's a specific day when you can't exercise, but if you feel awful, the thing to do is to just try and get a little walk in, try and do some stretching, just to get your, body going a little bit, because it might help you to feel better. So, why don't we go ahead and transfer over to, I'm going to stop sharing and you can put your, and then I'll tell for people who joined that there will be resources available on our website, as well as the recorded panel from tonight at cancer.ucsf.edu/forum. And that will be on the slide as well.
Okay, so I'll just tell you briefly kind of how I got into exercise. I've always been an athlete, playing sports as I grew up, and I was a runner like Michelle before I had my first son, or my only son. And then I couldn't run after that. And I just felt terrible that I couldn't run. I felt that I was almost addicted to exercise. And so I started doing strength training after that, and have become more acquainted and educated about strength training. And then I started to do CrossFit, and then I started to do Olympic weightlifting, and I compete in the Masters division in Olympic weightlifting. I'm not in the Olympics. I just want to clarify that for people. I'm one of the worst ones, but it's really fun and it keeps me healthy. And so I like to encourage my patients to exercise because I think it's really important for their health, and all the studies have shown that they benefit from it in decreasing risk of recurrence. But as Michelle has so eloquently presented, there's also a lot of benefits for side effects and general health as well. So this was a great topic that Hope came up with to talk about exercising in this era of COVID-19, because it's having a pretty big impact on our ability to deal with stress. We have poor sleep. We're having to do childcare and online schooling. There's lack of time. There's stress. I'm going to mention stress multiple times because I think people are finding it difficult to find time to exercise because they have so many competing obligations. And at the height of COVID-19, I know that sometimes some places the gyms and pools are starting to open, but everything was closed, and so people were at home and they didn't necessarily have their normal routine that they would have if they worked at a gym. People were afraid of going out because of getting exposed to people who may have asymptomatic COVID-19. And then people are having a lot of anxiety and depression and mental health kind of considerations because of isolation and the stress of COVID-19. So there's a lot of reasons why exercise could have fallen by the wayside for lots of people. So chronic stress is really bad for us. I think everybody knows this, but I just want to talk about some of the mechanisms of why it's so bad. It can raise insulin and cortisol levels in the blood, and it can raise these hormones that come from the adrenal gland that are involved with the perception of danger. Chronic activation of these hormones activates the sympathetic nervous system. And I'm going to show you a cartoon in a minute about that. The sympathetic nervous system is the part of your nervous system that responds to danger or stress. It can cause weight gain to have these chemicals elevated in the blood. It can increase the insulin level in the blood. It can interfere with sleep and suppress the immune system. Next slide. Oh, actually, I'm doing it right, sorry. So the autonomic nervous system is the part of your nervous system that can regulate response to danger, which is the sympathetic part. And it's the part there with the snake chasing the man on the right side. So if there's a snake chasing you, or a tiger, or something where your skeletal muscles have to react and your brain has to react to get you out of danger, these stress hormones of cortisol and insulin and adrenaline will be released into your body so you can respond to stress. That's supposed to be a short-term thing that happens so that you can get out of danger, and then the levels are supposed to go back down. The opposing part of the autonomic nervous system is called the parasympathetic nervous system. And this is the part of your nervous system that's involved with kind of automatic body functions such as your heart rate, your blood pressure, your breathing, your digestion, things that happen on autopilot. And when it's in balance, you'll be responding to stress when it's appropriate, and you'll be relaxing and digesting, and your heart rate and blood pressure would be lowered when it's appropriate as well. So there's a part of your brain called the hypothalamus, and the brain processes information through the hypothalamus, and the hypothalamus sends messages to the autonomic nervous system. So if you have bad news or poor sleep, it can affect the body's balance of the parasympathetic and sympathetic nervous system. If you have good news or a great meal or a very good interaction with a friend or a colleague, you might have a different message that gets sent to your autonomic nervous system. And consistent bad stressors shift the balance from this good seesaw of responding appropriately to chronically being in this fight, or freeze state. So it's very unhealthy. And our chronic stress of our normal life now can make that a chronic problem for lots of people. Sleep is an important thing too. Healthy sleep habits can improve insulin sensitivity. I'm going to talk about insulin in a moment. Lack of sleep is related to cognitive dysfunction and dysfunction of the immune system. And chronic sleep deprivation causes metabolic changes that are harmful and increase the risk of heart disease, diabetes, and cancer. So chronic deprivation is not always reversed when you pay the sleep debt. So if you chronically sleep 5 hours a night or 4 hours a night, and then, through the week, and then on the weekend, you have one day where you sleep 6 or 7 hours, that doesn't make up for all that time you missed your sleep. And then we know that people that have nighttime light exposure, so people that work the night shift, this can disrupt the normal circadian rhythm and promote, we know that it promotes and causes breast cancer. So that's something that has to do with our sleep system and our circadian rhythm. So people sometimes have sleep problems and they are overweight or they snore or they have high blood pressure. One of the things, if you know someone that has that, or if you are having trouble sleeping, is to ask your doctor about being checked for sleep apnea, which is a kind of disorder of sleep that can make it difficult to sleep and cause problems. There's going to be a sleep sheet that I've given to Melody to download so people can see how to improve their sleep. So the benefits of exercise are that it can lower cancer-related fatigue, it can decrease anxiety and depression, it can improve your sleep, so helping you with those problems that I just mentioned. There were some studies that we presented at our last forum about how exercise can help the heart recover from cancer treatment. So one of the things that Michelle mentioned was VO2 max, which is like your exercise capacity, your aerobic capacity. When people exercised after they got treated with chemotherapy and other types of treatment for cancer, they could return their VO2 max back to the normal level. And so exercise is really important for recovery from cancer treatment. Exercise can increase your muscle mass, aerobic capacity. It helps people not gain weight. And I want to say one thing that's really important about exercise is that the benefits of exercise are independent of weight loss. So when my breast cancer patients ask me or tell me I'm really frustrated, I'm exercising, I'm not losing weight, I tell them that it's still important that they exercise even if they don't lose weight, because it still gives you a benefit even if you don't lose weight. So insulin. I'm going to talk about insulin in the setting of breast cancer. Insulin is a chemical in the body. It's a hormone that's essential to life, and it allows us to clear glucose or sugar from our bloodstream. Insulin and other chemicals that are related to it can communicate with the cells of the body. And sometimes patients, as they gain weight or if they have more fat mass compared to their muscle mass, even if they're not overweight, but if they have this balance of higher fat mass and lower muscle mass, they can become insulin resistant. And what that means is that the cells of our body become insensitive. The insulin receptors on our cells become insensitive to insulin, and so more insulin has to be released in order to have the sugar go into the cell. So insulin insensitivity is something that's a problem, because insulin can interact with cancer cells, and many types of cancer can grow related to insulin stimulation. So this is a slide from a study in 2001, which showed that the amount of insulin in the blood is directly related to distant recurrence and death in breast cancer patients. So the higher the insulin level, the higher the risk of recurrence, the higher the insulin level, the higher the risk of death. Insulin resistance, there's many things that can cause this. One is body fatness. So the more fat that you have, the more adiposity that you have. The adiposity is a fancy way to say body fatness. Lack of movement, even if you're not overweight, if you don't move, it can cause insulin resistance. If you eat a diet that's high in processed foods and sugar, it can cause insulin resistance. People that have chronic stress and high stress levels, it can cause the insulin level to grow and cause insulin resistance. People that are sleep deprived can have insulin resistance. And people that have low muscle mass. So there's a word called sarcopenia. And what sarcopenia means is just low muscle mass. Sarcopenia happens to people as they age. So a person who's like a male who's 20 has more muscle mass than a male who's 80 years old just because of aging. So this is my last kind of, talking about this fat versus muscle issue, but adipose tissue or fat is not passive. The adipose tissue, it regulates a complex network of hormones and metabolic factors that can talk to cells, including cancer cells. And visceral fat, so fat that's in the abdomen cavity and in the organs, that type of fat that deposits inside the tissues, rather than the fat that's on someone's thighs or their abdomen where you can pinch it, the soft fat versus the hard fat. This visceral adipose tissue has been shown to be very inflammatory and very metabolically active and make a lot of chemicals. And an anti-inflammatory diet and exercise are important ways to counteract that pro-inflammatory effect. Now the muscles are interesting because muscles make chemicals also. And the muscles make chemicals called myokines that actually interrupt the ability of the fat cell to talk to the cancer cell and the other cells of the body. So when you exercise and you increase your muscle mass, you're basically giving support and funding the team that can interact and stop the crosstalk of the fat cell to the rest of the body. So the mechanisms of fat cell crosstalk are weight gain, insulin resistance, cortisol levels being high, adrenaline levels being high. Some of the things we talked about with stress. Sex hormones, so estrogen and testosterone, can be associated with the adipose tissue and how it talks to the body. And vitamin D and sarcopenia, or low muscle mass, can be something that affects it as well. So since strength training is kind of my thing that I love and is my specialty, I want to talk about the benefits of strength training, because a lot of people know about aerobic exercise and they participate in aerobic exercise, but they may not know that strength training lowers insulin the most of any type of exercise you can do. So if you lifting weights or exercising in addition to doing just regular exercise, whether it's running or walking or some type of moderate exercise, lowers the insulin level about 5 times as much as just the regular exercise. Strength training is the best way to increase muscle mass and decrease sarcopenia, or that lowered muscle mass that goes with age. So strength training can help you build muscle mass and kind of fight sarcopenia. Michelle mentioned a study that showed that strength training as part of the exercise program decreases lymphedema risk in breast cancer patients. And it also helps with recovery of strength and mobility after treatment, because sometimes treatment will cause sarcopenia and weakness. And if you do strength training, it helps you gain your muscle mass back and your strength back. It improves the quality of life. And importantly, especially in older patients, it lowers the risk of falls and fractures. If you take aromatase inhibitors, you might have an increased risk of fractures. If you're doing strength training, you're less likely to have a fracture because your bones will be stronger. It also strengthens your tendons as well as your bones. So the tendons of your hands when you're holding the weight, the tendons of your hand when you're doing yoga and you're holding a pose, when you start to feel it in your wrist, you're strengthening your tendons when you're doing that. So what kind of exercise should I do? My patients ask me this all the time. And I say to exercise 2.5 to 3 hours a week minimum. of some type of brisk walking, riding a bike, swimming, dancing, running, whatever you like. The most important thing is to pick something that you like. Maybe pick something you can do with another person if you have that option. And maybe even involving your children. If you're at home with your kids, maybe like have your kid go for a walk with you, and maybe find a way to connect with somebody in your exercise if you can. That makes it a little hard with friends because of COVID, but you can do socially distanced walking and you can wear a mask. Strength training 40 minutes a week. Most of the studies with strength training in breast cancer were done with 40 minutes a week. Coordination and balance exercises. And one of the things I want to say about that is that coordination and balance exercise help your cognition. So balance and coordination and learning new patterns of exercise that you're not used to, like mixing it up, as Michelle was saying, that actually helps your brain. It helps cognition. It helps decrease memory loss. And it helps stimulate what they call neuroplasticity, your ability to learn new things. And so doing some type of exercise, adding it, maybe on one of those days that would be your rest day, adding some type of exercise which you could do with coordination and balance is really important. The most important thing though is to find something you like. So I'm gonna just talk about like strength training. How can you do strength training in the era of COVID and there's no gym to go to? What can you do? So body weight exercises such as squats, push-ups, static holds, core work. There's lots of different things that you can do with just your body weight, and you don't have to have a gym. You want to focus on exercises that work your back, because your back has a lot of muscles. The front of your legs, your quads, the back of your legs, your hamstrings and glutes. Things that work your arm strength and also your shoulders. One thing not to forget is the feet and the hands. So I'm gonna just see if I can see myself here. So I want everybody just raise your arms above your head and raise them straight up above your head by your ears. And just now I want you just to open your hands back and forth. Just keep doing that. And keep going. And I'm going to count to 20. 1, 2, 3, 4, 5, 6, 7. You feeling it? 8, 9, 10, 11, 12, 13, 14, 15, open and close, 17, 18, 19, 20. Okay, so that's an exercise, that's a strength training exercise for your forearms and your hands. And I find that hard. It makes my arms tired. That's something you can do at home. But there's lots of exercises like that that involve your whole arm or your back or your legs. And you can do a lot of strength training without having to go to a gym or have weights. There's banded exercises that add a little bit of resistance. They're bands you can hook into the door, and you can do rows, for instance. You could have the band in the door and you can pull and push with the band, giving you some resistance, but without having to have weights. Those are really cheap to buy online, and sometimes physical therapists and exercise counselors will give them to you for free. Weightlifting, which I hope as many people as possible will eventually lift some weights. You can start slow and add resistance as you gain strength. With my coach, we have an app called Survivor Strong that I just want to mention. And it's a strength training app that we designed for breast cancer patients to help them have programming to follow to increase their strength. I'll just say, for full disclosure, this is a business that we have. And I just want to mention it because it is a way that we're studying how we can help people follow a program and they don't have to have a personal trainer or a gym to go to. They can do it at home. We're piloting that in some of the different survivorship groups at UCSF. Yoga is a very good exercise to try to do, and there's lots of online resources on the online resources sheet that we composed and we're going to post for you. There's a lot of free yoga. There's also a lot of different ones that you can find online. Yoga is very good for balance and body weight strength training. And it also does strengthen those small muscles like your wrists, your forearms, different places that are weak in people because of normal day life. Helps your posture as well. Sitting at the computer, over your computer, bent over, like I call it becoming veal, because you're just on the computer in your cubicle or at home. You need to actually resist that by working your upper back. And yoga is a really good way to do that, or Pilates. And the last one that people don't think about is strength training, but it really is strength training is gardening. So when you garden, you're lifting rocks, you're lifting soil, you're shoveling, you're pickaxing, you're using, your whole body, and just make sure that you're using your legs and your core and not your lower back. So when you're doing something or lifting something heavy, make sure you bend down and really use your butt, use your legs, brace your core so you don't hurt your back while you're doing heavy gardening or heavy strength training. So there are new studies that are showing an improvement in cognition with coordination exercises and balance training. There's an exercise kinesiologist and physiologist at UCSF. Her name is Reagan Frederick. And we've been working together on a survivorship program for the neurological patients, the neuro-oncology patients. And she keeps saying to me, you need to do coordination and balance. You need to do doing coordination and balance. And so we put a lot of those exercises in. And now I'm really convinced by looking at the studies that we really do need to challenge ourselves. We need to keep changing what we do. We need to learn something new. We need to mix it up. When I told Hope Rugo about my Survivor Strong app, I told her, I'm going to take this one out. I'm going to make this easier. She goes, no way. You need to make it hard for them. You need to make them use their balance. And she's absolutely right. So doing some hopping and balancing on one leg, doing what's called a bird dog. You can look that up online, what a bird dog is. And it's when you're on your hands and knees, and you're lifting one hand and the opposite leg up at the same time. And then you put both of them down, and then you do the other side. This type of thing where you're having to think, okay, I need to do one arm and the other leg, and I need to balance on one leg, and I'm gonna hold my hands here, I'm gonna hold my hands up. When you're having to actually think while you're balancing, while you're doing a coordination exercise, it improves your cognition. It decreases memory loss, and it helps with cognitive function. Dancing is also a very good exercise for coordination. So if you like to dance, you can dance for exercise, and it is a cardio exercise, but it also is a coordination exercise. And there's ballroom dancing online, so you don't have to worry if you make a mistake, or you don't worry that you look stupid, but you can do ballroom dancing, and that's also coordination and thinking at the same time. So my advice to you about this balance and coordination thing is that you need to make mistakes. It helps you get stronger and better, and it helps with neuropatterning and neuroplasticity, and helps your brain start to actually improve, because our brains can continue to get better as we age. We're not all washed up at 20. So this is my exercise prescription. And you think about diet of carbs, proteins, and fats. And so I just want you to think about exercise in that same way we think about diet. I don't believe in the keto diet because I think you need some carbs. I don't believe in eating super high protein and not eating any fats or carbs, because our bodies need all of these different building blocks, and our bodies need these different exercise building blocks. So I think of carbs as your aerobic activity, your moderate walking, your moderate riding a bike, or like Michelle, going out and doing a massive run. That would be intense exercise. So the way you know if it's moderate or intense is, can you talk but not sing? That's moderate. Can you not carry on a conversation? That's intense. So these are the recommendations right now for cancer patients, is 150 to 300 minutes a week of moderate, or 75 to 150 minutes a week of intense. Now, what if you can't do that right now? It is better to go out and walk 5 minutes than not to do it at all. And if you walk 5 minutes every day for several weeks, I bet you'll be able to walk 7 minutes the 2 weeks after that, and you'll be able to build yourself up slowly, your goal being to be 150 minutes a week minimum. Protein is strength training, and I recommend 40 minutes of strength training of all the major muscle groups if possible. And there's lots of ways you can do strength training. In the paper that we put together that we'll be posting for you, that you can download or print, there's a lot of strength training in those different free programs that are available. Some of them are low cost, most of them are free, but add some type of strength training, and you can just do 4 exercises and do them over and over till you get good at them, and then you can add new exercises or substitute. And then the fats in my exercise prescription is balance and coordination. We know that our brain is made mostly of fat, and so I feel like that's why I named it fats. But the balance and coordination is very important, and adding some fun things that you can do to help that part of your brain is important. The other thing is that children really like to do balance and coordination things. So if you have kids at home, there is one of the resources on that paper that I was talking about is called Allo Gives, and it is free yoga for kids and mindfulness training and stress reduction for kids. It's all free. And some of the programs, you can just do it with your kids and it's really fun, but a lot of them are balance and coordination. So that's a good way to get started if you don't know what to do for that part of the exercise prescription. So this is the website where the resources are online. And I just love these pictures of strength training. Thank you for your attention for today.
That's great, really excellent, and really enjoyed that discussion along with having the prescription. And it's important for everybody to know that we, of course, put this session is recorded, and so it's available on our website, as we discussed before. So we have a bunch of questions that have come in during your talk that we'll talk about. And one was the app. Your app is not available in general, though, the Survivor Strong?
No, it is available. So if you go to survivorstrong.com, it's the website where you can find out how to sign up for it. It's actually a prescription, a subscription, not a prescription. It's a subscription, so you pay a certain amount per month to have access to the app, and it has programming that changes. So every 4 weeks, you do 3 different exercises, 3 different programs per week, Monday, Wednesday, Friday, and it has 2 yoga sessions on Tuesday and Thursday. And it's the same for 4 weeks, and then it changes again. So every 4 weeks, it changes to a new program. And it follows the type of programming we do in Olympic weightlifting, where you do the same types of exercises for 1 month, and then you change to a new type. But it covers all the different parts of the body.
That's really helpful to know, and I think it's important for everybody to know that the websites, and somebody asked also about the web link for carb and protein, and the website are linked for kids. So you might just want to mention it now, and then also if you go to the website that Natalie mentioned, cancer.ucsf.edu/forum, you can actually find all of the resources as well as some additional resources that Natalie and Michelle put together. So exercise, and then Natalie put together a really nice resource on sleep tools. So go there, you can actually download it, you can read it from there, you can copy the links, click on them, and take them to various websites. So maybe you could tell the website again for the kids.
It's called Allo, A-L-O, Gives, G-I-V-E-S. And it's on that paper that's on the website.
And then carbs and protein, what do you like the best?
For eating, for real life eating?
Yeah, for real life eating? For real life eating, yes.
So I was wondering if it was the exercise prescription. So I actually think that I believe in the anti-inflammatory diet, which is kind of like the Mediterranean diet. So it's lots of fruits and vegetables, whole grains, fish, Limiting, you can have red meat, but limiting it to just 2 times per week or less. The thing about an anti-inflammatory diet is you want to do what's called slow carbs. So like sweet potatoes and getting carbs from vegetables and whole grains rather than eating processed things. So limiting sugar and limiting processed foods is kind of the best thing, I think, for
bread, things like that. Limit bread, yeah. Noodles.
I think you can have noodles, but have noodles on a day when you exercise.
Right. So that's good. And then the protein obviously is important, but I think there was a web link that you gave, and that's the prescription that talks about the different, how much to have of each food group.
Oh, the macros?
Yeah.
You know what, I can put something on the website about that, but no, that was just me talking about it.
And what was the website? You want to just briefly mention it again?
No, I didn't put a website for the eating thing.
I think it's what you talked about. People were interested.
Oh yeah, I didn't put that on the website, but I can put it on the website.
And what is it?
The exercise prescription?
No, the one you're saying you can put on the website, that's the exercise prescription?
I can either do that, or I can do like something about calculating your macros for eating.
I think that's what they was interested in, calculating.
Yeah, I can put some stuff up about diet, sure.
Okay, great. So yeah, remember cancer.ucsf.edu/forum. So there's another comment, which I think is really important for today, where, I went out of my house and my eyes started burning on my way to clinic, and there was ash all over my car because of the fires, unfortunate fires. So one question was, can you comment on the best way to exercise during fire season and all this unhealthy air? Is exercising outside, do you think an N95 type mask should be worn to trap the smoke particles, and cloth masks won't work if there's unhealthy smoke?
Yeah, what do you think, Michelle? You're the aerobics girl.
Yeah, well, I don't know the answer to that. I figured somebody would ask that question, and I actually, in the 15 minutes of free time I had today, I tried to try to see if I could find what the N95 or different types of masks would do, and I apologize. I don't know the answer to it. For better or for worse, I mean, I've never been myself very sensitive to that smoke. So I went outside and ran. I had a mask with me. When I put the mask on, I thought I was going to die in terms of just my inability to breathe as hot as it was outside. So I think that's a personal thing. I think, that this is a question that I'd have to punt to a pulmonologist. I'm really sorry. I
have to have a little bit of information on that, because
you have some great hope.
Yeah, just a little bit, and it's mainly because you do inhale the particles when you, go outside, and when you're running, you inhale more of the particles, and so it does set up an inflammatory reaction in your lungs. I think if you have very healthy lungs and you're young and you don't tend to any reactive airway disease, that you can clear most of those particles, but. And it's not as much of an issue, but I think if you have anything going on with your lungs, or as you get older, it's really a good idea not to exercise outside. If you are going to be outside in a heavy smoke area, you should consider wearing an N95 type mask, because that's what will filter the small particles, the ash from the smoke. But I mean, I think in general, if you're in an area with a lot of unhealthy smoke, you just shouldn't be doing a lot of exercise that requires deep breathing outside. And you should wear an N95 mask when you go outside. I think for San Francisco, it's a little bit less, and it varies a lot over the course of the day. So I think that you want to try and just be outside when there's a little less of the intense smoke out there. And it's, of course, better to wear a mask than no mask, and it's required by law. But the N95, if you're going to exercise, it's really important, even though it might make you feel like you can't breathe, as Michelle said. So, and
I should mention that I was probably not within a mile of anybody, because no other crazy person was outside. But yeah. Speaking of that, Hope, do you, the websites, there are a lot of people posting on Neighborhood Next Door, things like that, about different websites that provide the air quality. And I myself don't know which one might be good to trust, but that's another thing that
I
they're
think that
also.
everybody should be signed up, and this is of course totally aside, but everybody should be signed up for NIXL alerts, for your county, wherever you live, because of the fact that that tells us if, we need to evacuate, or if there are, pending threats in the area. So we actually have there's an alert SF, which tells you about the air quality, which has told me today several times that the air quality is unhealthy. And then you can actually click the link and find out what it recommends. It's not unhealthy all the time, but they do recommend that active youth, adults, and people with respiratory diseases should avoid prolonged outdoor exertion. So there is an alert going on all the time. You just have to sign up for those alerts. But, I think they're always going to recommend that, because if you have asthma, it can actually really be bad. And I think for some of our patients who have respiratory disease from their cancer or from treatment, it also can be a big issue. There's another really interesting question here about strength training if you have had an axillary lymph node dissection, which I think is really important. And because, as you mentioned, the issue about exercise really helping to prevent lymphedema is relatively newer from my career. And of course, was what I always thought. I thought it was crazy what was recommended before. But that's the kind of question, is which exercise do you really recommend?
So people that have had an axillary lymph node dissection can do strength training. And in fact, it actually can help people have better mobility. The most important thing, though, is that if you have significant tightness or fibrosis, like you've had radiation to the area, is to work with a physical therapist to just try to get your tissues as mobile as you can, after surgery, after you recover from radiation. But, some of the strength training exercises, for instance, just pushing up like this, initially you might be pushing up like that, like this arm doesn't go all the way straight, but eventually over time, you will actually get better mobility in your arm and shoulder from doing strength training. Part of it's just doing the motion, and part of it is the muscles around the joint get stronger, and you also are doing some stretching. So it's actually, there's not anything that you're forbidden to do just because you've had a lymph node dissection.
That's good. I mean, I think that's really good. And the kinds of arm exercises that you can do is really great. There's also, we saw a lot of data with Michelle, not a lot, but a good amount of data about reducing recurrence in patients who have primary early stage breast cancer. But what about in metastatic disease? Do we know if exercise improves outcome in metastatic disease? And if you have bone mets, is there a risk to lifting weights? How do you decide what's safe or not?
So I'll tackle the first question, and then Natalie maybe can ask the second one. So unfortunately, there isn't, data that's been, sorted out. Most of the trials and the data that we presented have been sort of retrospective. Well, there's the retrospective data on early stage patients, but I think, so the answer that is there's no data that I know of specifically that is focused on the metastatic breast cancer population. But what I think, I can say is that, there's, fairly compelling data about this, sort of all cause survival. And, so my thought is that, the first step towards, dying of breast cancer is having that, recurrence, if you have a recurrence, and the ability to participate in clinical trials, the ability to tolerate treatment, basically our assessment of whether patients are fit to get the next line of therapy. I think that I always tell my patients with metastatic disease, it's worthwhile to do everything you can to maintain all of your other health issues, keep your blood pressure under control, try to manage your diabetes, because, many trials will exclude patients if they don't have good cardiac function or if their hemoglobin A1C is too high. So although we don't have specific data that, like I showed earlier with early stage disease, I think that exercise without a doubt just indirectly is going to impact survival. That's my own bias. I don't have any proof for it, but the idea that you can actually affect all of those things that Natalie was talking about, insulin, you can affect your blood pressure and all of those things is going to have a positive impact on outcomes, I believe, I think it's across biologies. the more trials you're eligible for, the more fit you are to handle that treatment. I think it'll make a difference.
I agree with that too, but there's another part, which is the sarcopenia. So people that have sarcopenia, they actually have a worse outcome across many tumors. So that's been shown in prostate cancer, in colon cancer, in breast cancer, that people that have sarcopenia have a lower survival rate. So that's why lifting weights or doing strength training and keeping the muscle mass high is actually really important. As far as the question about bone metastases, people that have bone metastases can lift weights and do strength training. And it's actually really important that they do strength training and balance training so that they're less likely to fall. I mean, the really good thing that we have now is we have medicines that strengthen the bone so people don't have skeletal events and fractures the way they did in the past, that were just fractures that were just happening because the cancer was there. But if you fall, you could still have a fracture. So it's really important to do balance and coordination training and strength training, because you're less likely to actually hurt yourself by falling and breaking something.
I think that that's actually really important. And so if you were going to, for example, say somebody has bone metastases, can they lift weights? If they maybe should just check in with their oncologist and make sure that they're not susceptible to fracture at the shoulder or arms. I have had one patient fracture their humerus from doing nothing, actually. But generally, I think fractures in the upper extremities are much, much less common than the hips, for example. They're just smaller bones. And so I think checking with your oncologist is the way to go, and also trying not to lift more weights than you're really able to lift, so you have to do gradual strength training. Would you say, Natalie, that you agree with that?
Yeah, I would agree with that, to check in with your oncologist, because like if you have a special place that you have a cancer that your oncologist would be worried about, like let's say your femur, it may be that has to be addressed first. But you can do, if your doctor says it's okay to do strength training, you don't have to lift heavy weights to get the benefit. You can do body weight strength training and still get a very major benefit that helps you.
And lastly, because we're just now running out of time, and we're so excited about this whole program and that it will be available for additional people who couldn't make it or were on holiday this evening. I think that this is one really important question that a lot of patients ask me, which is that there's been mouse data on intermittent fasting in the context of cancer. And do you recommend that to your patients, either without, regardless of chemotherapy, or just intermittent fasting itself, or around chemotherapy?
I'll let you tackle that one, Hope.
Natalie.
I'm really interested in intermittent fasting. And in fact, I'm trying to get money for a clinical trial for intermittent fasting and strength training in breast cancer patients. So the data that you're referring to was just recently published. And what it showed is that mice that did intermittent fasting along with their hormone therapy actually had a much more dramatic and sustained response to treatment. It's a really fascinating thing. Well, it kind of makes sense, because in the diabetes and cardiovascular literature and in obesity literature, intermittent fasting can lower your insulin level, and it can lower a lot of the biomarkers that are associated with cancer growth. It can lower them by intermittent fasting. So it's never been proven in breast cancer patients that it's going to make your hormone therapy work better or make you live longer. But there was a small study, and maybe Hope, you probably know the name of the author, because I don't know that as well as you, but there was a 12 to 13 hour fasting per day, which is pretty easy for people to do. There was better outcomes in patients that did that with breast cancer.
Yeah, so there's actually a group. It's really fascinating. There's this whole group, and it is true, Michelle, that I got all involved in this whole thing about a study for intermittent fasting. But it's hard to find a granting agency that's going to pay for a big study on this. So it's actually going to be resubmitted. But there was a group. There's a guy at UC San Diego who actually came and spoke at our forum, which is how I got involved in this. And then some investigators in Italy who did this small patient study. I think that Natalie, at least in part, you're talking about, and some of the laboratory data came from them. And they did do this intermittent fasting, and they actually have a program diet. They actually provide meals, because it's not just intermittent fasting, it's also having this particularly low carbohydrate, special diet that they provide. So it's actually, and they have a whole acronym for it and everything. But I have to say that this is a fascinating area. There's really interesting research, but mice are not people. Our diseases are, the cancers that we see are incredibly heterogeneous and difficult to understand as a single disease, unlike a mouse program disease. So I think that the bottom line is that we don't know that intermittent fasting helps patients with breast cancer yet, but it's a really interesting area for investigation. We do know that not eating for 12 hours or even 10 hours is probably healthier for you in general than eating all the time. And there's good data on that. So it doesn't hurt to fast a little bit, but I think fasting for days, we don't have any data to support that approach. So we'll see what shows up in the future.
And actually, there's something interesting in the obesity literature that women who are postmenopausal, who do the 16/8 fasting every day, they actually gain more weight or can't lose weight the way that men do when they do it. And what they think is that if you're doing it every day, it increases your stress response, because women evolutionarily hold on to fat. That's like helps us survive and take care of our kids. But what they proposed is that if you do fasting like 3 days a week rather than every single day, it's like less stressful to the body. And so then maybe it's more effective. They're still studying it.
Yeah.
But I would say don't go and do 16/8 intermittent fasting every day, especially if you're a postmenopausal woman on hormone blockers. That's probably a bad idea.
And also you get more nausea with chemo. Anyway, we definitely are a little bit over time now. So I appreciate both Michelle and Natalie staying longer, for giving our excellent presentations, having this fabulous discussion, and for our participants for sending in great questions and sticking with us. And then, of course, you can let people know that it will be available. I've told you about the forum website, and then Melody Galu, who's done a phenomenal job about coordinating our virtual forums, also is available to send you that link in case you need it, where the resources that Natalie and Michelle have put together are. So I think it's actually been a great evening. I really appreciate your participation, and our next forum will be on September 30th. Take care, everybody. Stay safe.
Bye.